How do doctors rule out other diseases when diagnosing Parkinson's? Diagnosing Parkinson's disease can be quite intricate. Since there is no single test to confirm it, doctors relying on a combination of clinical evaluations and tests. They begin by looking for the main features of Parkinsonism, like slowness of movement, known as bradykinesia, along with either rigidity or a resting tremor. To help in this process, they use established criteria, such as the UK Parkinson's Disease Society, Brain Bank criteria, or the Movement Disorder Society criteria. These guidelines help differentiate Parkinson's disease from other similar conditions by requiring specific patterns of symptoms and how they progress over time. However, these criteria are not foolproof and may need follow-up assessments as the disease develops. Next, doctors consider various disorders that might mimic Parkinson's symptoms. This is known as differential diagnosis. Conditions like multiple system atrophy, which progresses quickly and has unique MRI findings, or progressive supranuclear palsy, which includes specific eye movement issues, are taken into account. Other conditions, such as corticobasal syndrome, dementia with Lewy bodies, vascular Parkinsonism, and drug-induced Parkinsonism, also need to be ruled out. Each of these disorders has different treatment responses and prognoses, making accurate diagnosis essential. While no test can definitively diagnose Parkinson's disease, neuroimaging techniques can help rule out other causes. For instance, dopamine transporter imaging can show the loss of certain neurons typical of Parkinson's disease, which may not be present in conditions like essential tremor. Magnetic resonance imaging scans can reveal structural brain abnormalities or specific patterns associated with atypical Parkinsonian syndromes. Another important aspect of diagnosis is clinical monitoring over time. Early symptoms may overlap with other disorders, so doctors often observe patients over a period. The pattern of progression, how well the patient responds to dopaminergic medications like levodopa, and the emergence of new symptoms can provide valuable insights. A strong response to levodopa often supports a Parkinson's diagnosis, while a lack of response may suggest an atypical form of Parkinsonism. Additionally, doctors review the patient's medical history and medication use to exclude other conditions that could mimic Parkinson's symptoms. They may perform tests to rule out issues like normal pressure hydrocephalus or essential tremor. Genetic testing and looking into non-motor symptoms, such as loss of smell, can also offer helpful clues, though they are not definitive on their own. In summary, ruling out other diseases when diagnosing Parkinson's disease involves a thorough clinical assessment guided by established criteria, supported by imaging and specialized tests, and careful observation over time. This comprehensive approach helps ensure that Parkinson's disease is accurately distinguished from other neurodegenerative and secondary causes of Parkinsonism, leading to appropriate management and care.